Ever wondered how gravity, wet lungs, and shape matching affect ARDS patients? Let's dive into the first factor, gravity. When we think of gravity, we usually consider its pull on solid objects. But in the case of ARDS, or Acute Respiratory Distress Syndrome, gravity plays a significant role in the patient's condition, especially when they're lying down. Imagine a patient lying on their back. Gravity pulls blood and fluids downward into the lower regions of the lungs. This makes it harder for the lungs to expand and contract, a crucial process for breathing. The result? An exacerbation of the symptoms of ARDS, which includes shortness of breath, rapid breathing, and severe lack of oxygen in the blood. Gravity, something we rarely think about in our daily lives, can greatly influence the condition of ARDS patients. Now, let's dive into how wet lungs play a role in ARDS. Acute Respiratory Distress Syndrome, or ARDS, can be exacerbated by the condition known as wet lungs. This term refers to the accumulation of fluid in the lungs, which can severely impact the functioning of this vital organ. Imagine trying to breathe underwater. It's a similar sensation for those experiencing wet lungs, as the excess fluid in the lungs impedes the transfer of oxygen into the bloodstream. This can lead to severe shortness of breath, and in some cases may result in organ failure due to the lack of oxygen reaching these vital body parts. Furthermore, this fluid buildup creates a breeding ground for bacteria, leading to potential infections that can further complicate the patient's condition. Therefore, it's crucial to manage this fluid accumulation effectively to prevent the worsening of ARDS. As we can see, the state of wet lungs can be a dangerous factor in the progression of ARDS. Lastly, we'll tackle the concept of shape matching and its effects on ARDS patients. You see, in the world of respiratory care, shape matching is a principle that emphasizes the importance of the lung's shape and the ventilator's settings being in harmony. Think of it as a puzzle. The pieces need to fit perfectly for the picture to make sense. In the context of ARDS, or Acute Respiratory Distress Syndrome, this puzzle becomes a matter of life and breath. When the shape of the lung and the ventilator settings are mismatched, it can lead to uneven distribution of air, potentially increasing the risk of lung injury. This is particularly critical for ARDS patients whose lungs are already in a delicate state. In essence, the goal is to tailor the ventilator settings to the individual patient's lung shape and condition, creating a match that allows for optimal oxygenation and ventilation. Shape matching, while seemingly a simple concept, plays a crucial role in the management and prognosis of ARDS. To sum up everything we've discussed, we've shed light on how gravity, wet lungs, and shape matching play significant roles in the complexity of ARDS. We've explored how these elements impact ARDS patients, from gravity's pull affecting lung fluid distribution to the internal drowning experience due to wet lungs, and finally, the conundrum of shape matching in determining lung compliance. Understanding these factors can help medical professionals better manage ARDS and potentially improve patient outcomes. Until next time, stay curious and keep learning.